All right, good morning. This is Senate Health and Welfare, and it is March 21st. And it doesn't look like spring outside, but we're moving along. So this morning, we're gonna pick up on S18 that came back over to us from the House with some proposal amendment, and we went through the side by side yesterday, Jessica, the Representative Rumstead, and I thank you for being here. Let's talk, one of the questions we had yesterday was the benefit of doing this, return on investment, more or less, and maybe you could talk a little bit about the bill and then the ROI, whatever. Yeah.
Okay. So this is Jessica Brumstead for the record, representative from House Human Services. And I thought, well, the way I sort of laid it out for today to try to be succinct is changes in the bill. And I know you've heard from Budget Council.
Well, it'd be good to hear from you, however.
And
Great.
so I'll just run through them and why, right? That's some of
Excellent.
my might miss, at least the biggies. But I mean, I've hit the biggies at least. Okay, so first effective dates were changed. Obviously, the ban now on January 26th versus January of 25. So why, right? That would be the first question. I would say two reasons. One is menthol. The trip to Health Equity Caucus meant that there were going to be two effective dates, and this way there'll only be one. There'll be the time for the Health Equity Caucus to take a look, or not caucus, sorry, commission, the Health Equity Commission, and it will also be able to be informed, and then we can move forward with the true ban. And I don't know how much you know about the Health Equity Advisory Commission, but I brought their purpose, and this is what really, the real reason why we did it. We were struggling, we were going back and forth on, is it good or is it bad? Like, are we targeting BIPOC and LGBTQ, or are we protecting? And is protecting targeting? There was that debate on our floor as well. So it all played out as it played out in our committee. But we created the Health Equity Advisory Commission a while ago. I'm not sure exactly when that happened. You probably know better than I, because we're not the healthcare committee. And the reason was that so that we wouldn't have to keep creating little committees to look at the equity issues, right? So the purpose is to promote health equity and eradicate health disparities among Vermonters, including particularly those who are Black, Indigenous, and persons of color, individuals who are LGBTQ, and individuals with disabilities, to amplify the voices of impacted communities regarding decisions made by the state that impact health equity, provide strategic guidance on the development of the Office of Health Equity, including recommendations on structure, responsibilities, But the point is that this is right out of what was written in statute. And so it seemed like an obvious for us. Of course, we should do this. So that's one of the reasons for the holdup in the dates, the effective dates. But the other one, obviously, I hate to talk about just money when we're talking about saving kids, but obviously revenue was a concern for the Ways and Means Committee. And that's where this amendment came from. So it didn't come from us, but those are the two reasons. Next thing is the chart differences, right? And I say chart because we created our own little chart on what is legal and what isn't legal, right? And so all flavored vapes were banned for January 2026. All flavored tobacco substitutes, which are any tobacco substitute with a characterizing flavor, banned for January 2026. All flavored e-liquids, you know what that is. January 2026. Menthol cigarettes was going to be July of 2025, so that got switched to be part of the whole bill, of course, to January 2026. Menthol tobacco products, 2026. All other flavored tobacco products, that's the piece that's different from your bill, and that is little cigars, snuff, shisha, smokeless tobacco, chew. All of those things continue to remain legal. So why? Big discussion on this. We looked at the data, again, I'm the one in the committee who's constantly saying, accountability, we should make our decisions based on the data that's available. And so the reason was that the data that we saw was that most kids, when they quit a flavored e-cigarette, were going to menthol cigarettes. They were not going to chew. They were not going to a cherry flavored pipe. But yet we were hearing from a lot of older men who had smoked a pipe for a very long time. That was what they switched to when they realized that smoking wasn't healthy in the old days. And honestly, I remember my dad who smoked a pipe, a cherry flavored pipe, and you'd come into the house and it was sort of that warm feeling of smelling the cherry smell. Anyhow, that wasn't the reason. I didn't bring that up in committee, but we want to make our decisions. This is really, if it's truly about getting youth to stop using flavored e-cigarettes, this seemed like something we could give on. And so we did. And then unflavored, non-alcohol cigarettes, unflavored e-cigarettes, plus your kids, remains legal as well.
So could we have a copy of that,
No, this is something we made up in committee.
Is it on your webpage?
Seems like.
Yeah.
It's probably on your webpage. Yeah.
It's still off, it says January 25, but I'll fix those dates and.
If you have it so that you can do it electronically and keep, you can pick it up, that'd be great.
Okay, I'm happy to do that. Okay, so that is, a couple of the differences. Let's move on to e-liquid change from ways and means. There was a small change in the definition, and I'm sure you heard that from Jen yesterday, but the reason for that change was to narrow it just a little bit we were concerned that aerosols that are sold without nicotine, things like breath sprays, were illegal under that definition. And so we made sure I put in the word nicotine, and that's really the main difference. You probably heard that too, so. The other change in the bill, increase in penalties paid by sellers and dealers. So we increased some of those penalties because we're hearing from a lot of folks that you're not enforcing, it's not a big enough deal if they sell to if a dealer comes in and sells. There's more on that, we'll get to that. Also cessation options were strengthened a bit. We expanded, well, let's say 12 years of age or older to consent to treatment for dependence on nicotine is now okay. So up till now, one of the big things that I heard in high schools over and over again was we can't even give these kids cessation gum because as a school student nurse, because they're underage, right? So how do we do this? So we updated the language in existing minor consent regarding treatment for substance use disorder or sexually transmitted disease to include nicotine as the drug, right? As another drug that would be okay for. And honestly, I've received 3 letters from the high school in my town that are thrilled about this because they really were feeling like, hey, you can either, that the old, what do we used to say, you can bite a bullet or you can go counseling. Well, counseling just doesn't do it for these kids who, as you all know, are really addicted to a lot of nicotine.
Addiction.
Exactly. And the other big problem that we heard was a lot of these kids who are truly, truly addicted are juniors. They're getting ready to either go to college or to a technical school. And then all of a sudden we take away their nicotine. It's hard for them to focus and still do well in school. So we want to give them some options. And this is why that change was made. The other piece is the increased regulation. So to go back to that, we really don't want to bind kids. We want to get them tobacco cessation help. So we started out in our bill, or maybe we had that in the Ways and Means bill, I can't remember, everything gets mixed together. I just wanna say, we voted it out of our committee on January 29th. It was on the notice calendar on the 30th, went to Ways and Means, and we just passed it last week on the floor. So it's been a long wait, and in that time, there were a lot of amendments, as you
I
might have
haven't
seen.
looked up the date it left here, but so it's been
It's been a long
yeah.
time, right, exactly, for these folks who have been following us, right? So. Let's see, I wanna make sure I say this right. So we started out by offering a diversion program as an option. So to set it up similar to the diversion program for alcohol and marijuana, and we did that because we thought it would be consistent across all areas. Well, when Ways and Means looked at it, they decided to send it over for a flyby to the Judiciary Committee, the House Judiciary, and House Judiciary heard from the Attorney General's office that does the diversion program, and there were all kinds of issues, you know, who would do this, and there was just a lot of questions, because we had gotten okays on it from the Vermont Department of Health, that they would do it, because that's what they're doing now. They're doing the cessation programs for the high schools and the middle schools at this point, and they've added that in with the tobacco money. So we thought, all we wanted it to do in the Attorney General's office was to have like the civil ticket kind of thing, and if you don't wanna pay the $50 civil ticket, then you would go over to Vermont Department of Health and have the diversion. You would then do the diversion, just like you would if you had been caught with alcohol, right? And that's where things sort of fell apart, because they do the training at the Attorney General's, you know, as part of that, they have like a whole little section that does diversion. And so they were like, we might be able to do it, let's talk about it. And this was close to the end where we were gonna try and get it on the floor. And so we started thinking more about it, and we amended back with a change. Which I think we probably drove Ledge Council a little nuts, because we kept changing things at the last minute efforts. So we took out the diversion program and worked with the Vermont Department of Health to do it all through the Vermont Department of Health. And that is what's happening now. And that also increases enforcement. It's very similar to the diversion program, but a little bit different, because the training is through Vermont Department of Health, and they will be doing the check backs on, okay, you didn't pay the $50 fine and you didn't do the cessation. What we want is we want them to do the cessation, and we want to make sure that we're following up on that, and that's what that's all about. The other piece is Representative Marcotte had a great amendment that he and I worked on together, which was working with the Attorney General and the Department of Liquor Lottery. You may remember from testimony in your committee that there was a pilot program regarding internet access, which is really where a lot of the flavored products are coming from. And so we knew that the pilot project had raised close to a little over $1 million in fines over 3 years. And then was about to end. And so we had hoped that we could continue it with conversations, but we needed to put more behind that. And so we talked with the Department of Liquor Lottery, and they asked for a separate DLL investigator who their total job will be to go after these internet sales for tobacco and alcohol. And so, because they did in that pilot, they also found that alcohol was had even more issues. And the nice part about what they've been doing in alcohol, and they hope to do in e-cigarettes, is that they would hit a manufacturer or, you know, company with a fine. In the beginning, it's small, right? So they pay the fine, but they don't change anything about that access. What happens is, as they do it again or again, then the Attorney General really hits them with a fine, and they often want to negotiate. So their negotiation piece is to make it a zip code in alcohol. So in other words, you go to buy, a case of vodka or whatever, and you put in your zip code, your address, and when you put in the zip code, it immediately pops up and says, Vermont says, no, you can't do that in that state, or whatever. We don't have any of that with flavored e-cigarettes, and what we're hoping is that this change will do that. So Representative Marcotte introduced it, it was, very well received, and that amendment went through. And if we don't get this bill through, you guys, we are even thinking, do we put it on another vehicle? Because this is really important, could reduce the amount. Okay. Second thing, that's the most of the changes that I felt were important enough to talk about. And now I know that your chair wanted me to talk a bit about revenue losses and how.
Can I ask a quick question before we move to?
Yeah, let's do that.
There was a really good show, piece on NPR this morning about menthol, and I mean, it really does sound like it's gonna be coming from the feds, the ban on menthol, so. Did you all talk about that at all? Because it seems as though, I mean, I'm glad that this is going to the Health Equity Committee, but. If the federal ban gets put in place, that'll all be moved, right? So.
Yeah, that's a good question for, Ledge Council.
Yeah, and we did talk about it, just a quick
Yeah.
answer, we talked about it, and it takes the federal government forever to do anything, and right now they're in the middle of a campaign, and it just, we didn't have any faith
Right.
that would happen.
It
We'll
sounds,
continue. It would be great, because then we wouldn't have
Right.
people moving from.
yeah, and it does sound like the tobacco companies are making menthol-like products, and of course, there can be lawsuits around that, and it's a moving landscape, but I was just, thank you for.
Yeah. I mean,
Knowledge,
menthol's a real seller for us, because we came very close to just removing menthol from this, because the most was from adult users who said, what about adult choice? And, but it was just the science was so strong on menthol, that even I'm someone who, when my kids were sick, I would buy the little menthol rub that you could hear. And I found out when I was listening to the science why that was, because it opens up your airways so you can take in more and breathe better when you have a bad cold. Imagine it in the nicotine, that you're smoking it and it's opening up your airwaves and allowing more nicotine in and the ability to become even more addicted. So we knew we had to do something. So anyhow, okay, back to revenue losses. As you know, the Vermont, so this is not all my area. This was Representative Carol Odie is the Ways and Means member. She's away for 3 days, so that's why I didn't say that yesterday. But she did the report on the revenue losses and why they moved forward, even with them. And so in the House Ways and Means Committee and in our committee, Vermont Department of Health's Commissioner, Mark, he came and spoke to us, and in Ways and Means, he especially focused on this issue, and that the commissioner testified that the annual cost, and it's on page, here it is, whatever this page is.
What does it look like?
That the
Okay.
annual cost of treating tobacco-caused illnesses in Vermont is $404 million annually. And even more important is that 93 million of that is in direct Medicaid expenditures. A state and federal tax burden of about $1,300 per household, compared to a fiscal note of 7 to 14 million in the first full year. So the first year in 26, it will only be half a year. The data shows that in Vermont, for every 1% reduction in Vermonters who smoke or vape, there will be healthcare cost savings of about 8.3 million. And I'd like to think that Vermont, that's what I said on the floor, that Vermont does not want to build a budget with funds from kids addicted to nicotine. The other thing I will say is that DEVA and VDH came together in 21 and 22 to do a concerted effort on cessation. And in that effort, there was a 2% decrease among Medicaid, Medicaid recipient, people who are on Medicaid. There was a 2% decrease in those that smoked. This meant 16.6 million cost saving in 2023. And the commissioner said that. So I felt like, okay, this should be good data. And
Sure, thank you. The $76 million in Vermont tobacco tax revenue, that's all tobacco products, correct? That's
Right.
not just the e-liquids and the flavors.
yes, and that's why, so it's regular, all the regular cigarettes, the regular, no flavored, I should say, and the no flavored e-cigarettes, which is not much use in, and the tobacco products. So remember, the tobacco products are still
Right.
in, so that will be part of it, and then all those e-cigarettes, all the unflavored, and then, that's the biggest chunk of users now, is the plain cigarettes, of adults, and
Right.
that. It's so interesting to think, and this was in my report, and I'm happy to share any of my information with, are you the reporter or the person on the floor?
Well, we can share that.
Okay.
Yeah.
Well, the thing that really just struck me is how he watched over many years, 50 years, right? The number of smokers go down a little more than 60%. And then the tobacco companies and marketing, they got together and said, what are we gonna do? Because we know that it's the youth between the ages of 12 and 18 that are the biggest chunk of people that's how you start. And if you're not a smoker at 25, less than 2% become a smoker after 25, right? You all heard this. And so, okay, what's the best way to hook kids? Candy flavored cigarettes. I can remember as a little kid going to the store and buying the box of white sugar make-believe cigarettes that had like enough pop on them that you could make them pop because they had powdered sugar on them. And so that's exactly what they did. They took that and said, oh, let's put some nicotine in this, and we got a way to hook everyone. And that's what they did.
When did this plot
Oh.
begin? Was this like the early 2000s?
I think it might have even been in the 90s that they thought about it, but I don't know the exact, when it really took. And when they realized kids were liking this, then it was in the 2000s.
Yeah.
When it's funny because in my report I talked about how, we went from a society where it was really cool to smoke a long Virginia Slim or a short. You didn't watch a movie without people smoking. And even now, if you see a black and white movie that's meant to be old, they've got everybody smoking. And so it's cool. And then after the settlement agreement, right, master settlement agreement, it was like really out. You had to go smoke outside. You went from being given 3 cigarettes on an airplane when you went for a long flight to no smoking on the airplane, right? Or in the beginning, you could smoke in the back, which was really weird. But, and then we had kids, my kids in the late 90s would say, yeah, gross, when their grandparents smoked, right? So, and then now we have what we have now, and I'll have to tell you, one of the things I wanted to say was about our vote on the floor. It was 83-53, closest vote I've been a part of. And that's 22 were Democrats. So, which for many reasons, I'm not, no casting any aspiration, but we have a younger legislature, I believe, or the House. And I think there are people, you are blown away by how many people are using, and I can imagine why. They're concerned about losing mint and cherry and grape and all those things.
So this represents some of the data that you got, healthcare costs and savings, actually, as a result.
Yes,
Yeah,
all of that.
the commissioner did testify in here, and this is an update of some of the information that we received. We also got information from Heart Association just directed toward cardiovascular disease. And then we had testimony from the cancer, the Pulmonary Society around pulmonary disease. This is very helpful. It's good, because there were questions about, we're losing revenue, but if we look at the healthcare savings, it's significant,
Yeah,
and that's important.
I think the other really big thing in here is that kids and adults, will they travel to other states? And is this gonna hurt my small market? That's a big discussion. So we looked into that as well. Convenience is key for consumers. Let's always remember that, especially youth with limited resources to travel. The evidence. What we found, data from the Department of Health in Massachusetts showed the number of both convenience stores and retail tobacco licenses have increased since the law took effect there. In February of 2020, there were 6,258 tobacco retailers, of which 3,767 were convenience stores. And as of April 2022, there were 6,491 tobacco retailers, including 3,994 convenience stores. So when tobacco users did quit, the money they spent on tobacco products in state retail stores, initially going to New Hampshire, the numbers went up, then the numbers came back down. But the money came back into the retail stores in Massachusetts. It said the money did not disappear from the economy, but shifts to consumer spending on other products or services. Some people did leave Massachusetts and this was to buy nicotine products in New Hampshire, evidenced by increased sales. However, after 6 months, those changes were not apparent. New Hampshire's increase in tobacco sales went back down to where they were 6 months earlier. These sort of comparisons are really hard to make in Vermont, but overall, none of the states that have passed flavor bans have found that their revenue losses have created any sort of state crisis with a loss of small convenience stores. And the ones that have it, Massachusetts, Rhode Island, New Jersey, New York, and California. So, just so you know, for anyone who cares, I have 27 questions that I made up. And with 27 answers.
Do you have
Because I have
that?
150 members.
Can you share that?
Yeah, I
That's
can if you
awesome.
want. I
That's
mean,
awesome.
it's
Really helpful.
that's what this whole folder is just Q and A.
Oh, you've done a great
And I
job.
was on the floor for 5.5 hours responding.
I know, you're a hero. I don't know how you did that.
Wow.
Yeah, there were like 9 amendments. The list goes on.
How's such a different animal?
Yeah.
I watched a lot of it, I sat through it.
I'm sorry.
I watched your
Oh, did
testimony
you?
after we got out of the Senate.
Oh, you came out and watched. Yeah.
It's an important issue.
Yeah, definitely. It's a big deal.
Yep.
And there are I mean, it's a hard one if you're a small grocer, convenience store struggling already. We do a lot to our little stores. And then you're worried about, tobacco is a big area where you can make a little bit of profit. And it's hard.
I just want to thank you for the internet, that you and Rep Marcotte working on that, because that is a thing that has come up multiple times in my discussions with people is, kids are just gonna get them on the internet anyway. So I think if that position and that whole program and the position is.
We were
funded-
paying for it.
Yeah, the way that I was just about to say, the position is being funded by,
Yeah.
how is it being?
So the first year, it might even be the first 2 years, I can't remember, but it's tobacco, the settlement funds. And then it switches to the fines we take in. And if for some reason, say 5 years goes by and we're not taking much in fines anymore, then the position will go away because that will mean that we've done a good job and they're not for both things, right? So they're gonna put together alcohol and tobacco will be used, those fines for both things, because it will go after both areas of that position. And the Attorney General who collects the fines we made a deal so that would be shared.
So it'll come to the general fund? Some of it?
So
Or
whatever,
go- or
yeah,
go
whatever
to
is
the
above and
department.
beyond. It'll come to the general fund, I assume, again,
Okay.
Yeah, I think there is
Okay.
language that the extra would go to the general fund, but I think it goes to a special fund to fund the position first, and then the
Probably,
extra
yeah.
goes to the general fund.
Yeah,
Okay. We don't have that. Or it's flow throughs.
I don't know.
Just a question if I could on smoking cessation. So is there anything currently preventing a 12-year-old from getting,
Yes, there is. They, it's not included in the drug list of things that they can access without parental consent.
so it's about the parents, not the kids?
Yeah.
So this is again, kind of removing the parents from the knowledge that their children are having a smoking challenge.
And which, yeah, I mean, which has been, it has been shown that that's one of the things that makes them very nervous about getting cessation help. And that it seems like if we're gonna give them help on some of these other very big drugs, why wouldn't we do it for nicotine? It seems that we have to. And also our leaders in the high schools that deal with this were very, very supportive of doing it. Remember also that their coaches sometimes will throw them off teams if they're found out to have been smoking. And that too, it feels very punitive and not giving them the opportunity to quit without that kind of horribleness that goes along with it, which is losing out on your team, losing out
Yeah,
so many things.
yeah, we've heard a lot from, well, our district about schools that are very positive on doing everything that's here.
Yeah, it's been great.
I just want to say to my colleague's question, I think kids who smoke don't tell their parents. I think that's part of,
Oh, yeah.
I don't know about y'all, but when I wanted a pup, I would hide from my parents in the backyard behind a tree. I mean, you know, it's not something you share with your parents.
It's true.
Right, so I think that's a really important part of it.
The other piece of this that we have to continue to think about is the addiction. It's an addiction, and kids don't recognize that they're addicted. And they're not gonna tell their parents. They don't have they're just not gonna say a word about it.
Right.
Gonna test it.
Yeah, even the parents who testified in our committee, who had been told about this kid coming to them crying that this had gotten this bad. They wanted to help them, and it is a big deal. They would have to bring them to a pediatrician. They would have to, in order to get
Yeah.
cessation help. So I really, a lot of parents were very supportive of having this done. They couldn't believe the things that they could do without parental support and not this. I mean, without telling their parents. So I think it's pretty.
To that end, I can share it with you all that the school nurse who's the president of the School Nurse Association and one of the school nurses at Middlebury High School wrote a great op-ed.
Amazing. I used it out.
Yeah, a great op-ed about her own daughter's experience with getting addicted to vapes and how she didn't know about it, and then her daughter confessed and now she's getting treatment. But it's a really powerful op-ed about, and both from the perspective of a mom and a school nurse.
Where is it? Do you wanna post that? Do you wanna?
I can, yeah,
Yeah.
and I think it was in Digger and in the Addison Independent,
I missed
and
it.
she just reached out to me just this morning before I came to committee, and I hope you're supporting SAT, and so it was, she's great, she's a great school nurse.
Cool.
Obviously a great mom.
Yeah, school nurses are on the front lines.
They really are. So the long lines, I went and watched one day at lunchtime, this long line of kids who didn't smoke all morning and now they're feeling.
Really?
Oh, yeah, CPO.
It's the same way with the counselors, similarly, they just wanna have support.
And that was to keep them just continue going. And they aren't supposed to do that. That's considered not okay, which is to me.
So you've spent a lot of good time with us and we really appreciate the work that you've done. It's amazing, yeah. So if you have the frequently asked questions or things that you can share. And, you can send them to Kiki or for Martine, and that would be great.
Okay, and I can send my report if you want me to.
Yeah, sure. Well,
We don't really need a whole report.
no, but we'll post it. It's always helpful, for us. And you've done a lot of work. People should know that.
Thanks. Fighting the good fights. Representative Donahue helped as well. She was really very supportive on this one.
Great.
So it's good.
Thank you.
Yes.
Yeah, no, I thought it was a team effort and it was bipartisan in
Yeah.
a lot of ways. So,
Definitely.
yeah, it was very different. Thank you.
Thank you, and I hope it happens now after all this, right?
All right.
Okay.
Well, I thought, Ted Barnett was going to come in. Is he available? Oh, he's coming in at 10. So Jen, why don't we move on to the bill and then Ted's coming in with his fiscal note. That we, oh, I see it's 10 on the thing. So let's look again. Now that we've heard more from Representative Brumstead, we might be able to ask better questions going through the side by side. Because this is a refresher course for us from last year.
Yes, or do you want to look at the side by side or the bill itself?
Why don't we go through the bill and see how that works, and then we've got the side by side first.
I'm gonna do.
Sorry.
Hmm?
You are, okay.
TK.
Okay, okay. Do you want to send it to the wrong?
The other Terry has a quiet thing too.
Yeah.
She's T Wood. So we exchange emails all the time.
I'm sure you do.
Her name ends in I, right?
It does.
Yeah.
Good morning, Jen Carvey from the Office of Legislative Counsel. That's 18. House proposal of amendment. S18, as you know, is an act relating to banning flavored tobacco products and e-liquids. And as we talked about yesterday, they reduced the number of findings and took 3 of the findings from the version that the Senate had passed. Around the costliness of tobacco use, youth usage, and menthol cigarettes.
Sorry to interrupt, but is my
Wait, do you-
phone there anywhere? Thank you. Now it looks like I didn't leave it here.
Is it- where did you put it?
I don't know, maybe in the bathroom.
Oh,
We should
If you find
ban,
one, let me know.
we should ban phones from the state.
we'll keep our eyes open.
Oh my gosh.
Holy Ned.
Section 2
Oh.
amends 7 VSA chapter 40, so as we talked about yesterday, the House version put all of the definition into the definition section, almost all of them, and alphabetize them. So here's the definition that we talked about of BDs. You'll see it crossed out further in the section. It's not a new term, it's just newly re-alphabetized at the beginning. So we have definitions of BDs, board, characterizing flavor, child resistant packaging. Again, I've just pulled some of these right out of where they were in individual sections in the chapter, them on the definition section. Cigarette, commissioner, tobacco products is struck because it's moved down and revised to get rid of the cross-reference to Title 32. Same with vending machine, e-liquid container or other container holding a liquid or gel substance containing nicotine. All these definitions are here in first part of the section. One thing I'm not sure we talked about yesterday, but they did add in-house a definition of nicotine, so it was clear what we're all talking about. Maybe the chair will be the only one who understands what that chemical or substance terminology means. I'm a lawyer, I'm a scientist. But it also includes, and whether it's naturally or synthetically derived. So when we're talking about nicotine, it's an expansive expensive use of the term regardless of
So
its
the
derivation.
question is, so it's nicotine itself, it's not,
Or any salt or complex. And whether
need to think about.
naturally or synthetically derived. This is, other than the naturally or synthetically derived, this is the definition from the FDA. So the piece at the end about naturally
We're
or
not
synthetically
going
derived.
into the tobacco. I mean, because there are, you can breed tobacco that has higher levels, so we'll forget that.
Proper proof of age, again, all these definitions are in here, so you can see BDs was an existing definition, we just moved to the front of the alphabet. Lungs. So a new thing we talked a little bit about yesterday in the definition of tobacco substitute is that in this definition, it's any product that is not a tobacco product. And that was important because the definition of tobacco product includes things that contain tobacco. And so we were trying to make sure that when we're talking about nicotine, we're talking about it wherever it comes from, but not lumping tobacco products, nicotine, that may contain trace amounts of nicotine, and with tobacco substitute, we're regulating them in their own categories. So tobacco substitute is a product that is not a tobacco substitute and meets one or both of the following definitions. The first one is the one that we typically talk about, which is kind of this e-cigarette idea, something electronic or battery powered that contains or is designed to contain, contains or is designed to deliver nicotine. And here's the other substances language that was of concern to some people once we got into through inhalation or other absorption of aerosol vapor or other emission. And there was concern about whether that was overly broad and sweeping in nasal sprays, breath sprays. But I think you can argue breath sprays are topical, but nasal sprays are meant to be absorbed. And then they added an oral nicotine product or any other item that is designed to deliver nicotine into the body, including a product or item containing or delivering nicotine that has been extracted from a tobacco plant or leaf. That's where we're regulating them here. And the oral nicotine product, the main one that they're talking about is those little pouches that are, I think, a fairly new addition to the marketplace. And then vending machine, wholesale dealer, or existing definitions. Section 2, the licensure requirement is just adding e-liquids into our existing statute. I believe this is almost the same as what came out of the Senate, except we've now defined wholesale dealer as its own definition in this chapter, so we don't have to go to the Title 32 definitions. That was one of the things, is just to try to get all the definitions about tobacco in the tobacco chapter without incorporating some by reference to the tobacco taxes statutes, even though we're I use that same definition. So we're being consistent, but we're regulating in one place.
I do.
Yeah.
It's a little out in left field, but all the amendments that were made to this bill on the House, were they made on the floor?
No,
So they were all pre,
many of them were in, so the things that happened on the floor. The investigator position that you heard about was a floor amendment. There were several amendments that did not pass or that were drawn as well, floor amendments.
Sure.
So Ways and Means, the Ways and Means amendment, we talked about a little bit. There was the two amendments for Representatives Donahue and Brumstead dealing with the diversion piece, taking it out of the Ways and Means and then putting it in new language. And Marcotte, and that was it. Floor amendments. Everything that's happened either in human services, most of it was human services, and a few in Ways and Means. Sure. All right, section or 1003 here is again adding e-liquids, but also this is the language I mentioned yesterday with a new prohibition on knowingly enabling the usage of tobacco products, tobacco substitutes, or e-liquids by a person under 21 years of age. And then here's the piece with the penalties where we're trying to tease out some of the retailer versus the employee. So except as otherwise provided in subdivision B, which is specific to the employee, a person, including a retail dealer, who violates the ban on selling or providing products or knowingly enabling the usage to minors is subject to a civil penalty of not more than $500 for the first offense and not more than $2,000 for any subsequent offense. And if it's a retail dealer, an employee of a retail dealer, they're subject to a civil penalty of up to $100 for the first offense, up to $500 for a subsequent offense, and that's in addition to the penalty on the retail dealer. Okay. Fairly standard language in a lot of these sections about being brought in the same manner as a traffic violation and within 24 hours of the alleged violation. So this is the piece that has still going through the judicial bureau. This is next is the expansion, at least in concept, of the vending machine prohibitions. An existing law, all vending machines selling tobacco products are prohibited. This is expanding that, not just selling, but also dispensing and including tobacco substitutes, e-liquids, tobacco paraphernalia, or a combination of them. Then we have an existing law. You have a question, Rebecca?
No, I was just hearing music somewhere.
I do too, so it's not a problem.
Okay, I'm not just hearing things.
So this is a little bit of a conforming change that I think may have been in the Senate version as well. Clarifying that the exemption from the otherwise applicable prohibition on or limitation on where tobacco products, tobacco substitutes, and now e-liquids can be displayed. The exception for items located in a commercial establishment that is not open to people under 21 years of age includes not just a display of tobacco products, but also of tobacco substitutes or e-liquids. That is a conforming change. Then we have the sale and purchase of BD's language. So as we talked about yesterday, there is an existing prohibition on purchase and sale of BDs, but the penalties are different. The House has aligned these so that the purchase and sale both are $250 for a first offense and $500 for a second subsequent up to those. Definition of little cigars was moved into the definition section. We did keep the definition of enable the usage of tobacco products, tobacco substitutes, or e-liquids in this section. And that means creating direct and immediate opportunity for a person to use them. Again, that's aligned with the alcoholic beverages statutes. 1004 on proof of age, we've just added, as the Senate version did, e-liquids, some non-gendered language, and then moved the definition of proper proof of age to the beginning of the chapter. Section 1005 is the persons under 21 years of age and possession for purchasing, and so made some conforming changes in the section heading to specify it's not just tobacco products, it's also tobacco substitutes, e-liquids, tobacco paraphernalia. And under existing law, it actually has a typo in existing law, which says misrepresenting age or purchasing tobacco products. It should have been for tobacco products, but in this case, we're just taking that out entirely. So just saying misrepresenting age, the penalty. Adding e-liquids throughout, making non-gendered language changes. And that's it. This is the one that saw a lot of changes throughout the process to put in diversion and all of those aspects, and then was restored to existing language with the directive to the health department to come back with proposal for diversion. 1006, posting of signs, just adding in e-liquids. 1007, this is where we had moved the penalty for selling or furnishing items to someone under 21 years of age up to section 1003. So the prohibition and the penalty were in the same place. So here's where it gets struck from. But most of the language is not exactly the same penalties. Then just a couple of cleanup changes here on the names of House Committee and Advisory Council. Contraband and seizure, updating the contraband and seizure statutes to refer not just to tobacco products, but also substitutes, e-liquids, and tobacco paraphernalia. that have been sold, offered, or possessed for sale in violation of statutes and expanding the list of statutes they may have violated. And then also broadening that list as far as which items get destroyed. And I think most or all of that was in the Senate Act version. Internet sales, we've talked some about internet sales. The first thing that happened was all the definitions were moved up to the beginning of the chapter. All those come out, and then updating the language on e-liquids and making each violation or each shipment of and adding to that list of products constituting a separate violation. And 12 is updating the language, and I think this was the same as in the Senate version as well, on e-liquids or similar to, and other substances containing nicotine. So this is an existing statute on child safe packaging. Definitions were moved up as well. 1013, here we go, here's the flavor ban. So no person shall engage in the retail sale of any flavored tobacco substitute, any flavored e-liquid, or any menthol flavored tobacco product. We talked some about the menthol flavors yesterday, including in fact, that's the only kind of flavored cigarette allowed to be sold currently under federal law. And the feds have been working on some rules for quite a while now on banning menthol, but those continue not to be in effect. The penalty for violating, again, it's a ban on retail sale. So there were a number of questions on the House floor about what happens if somebody drives into the state and they have menthol cigarettes on their dashboard, can they get pulled over? No, it's retail sale. So the prohibition here is on retail sale. Person who violates that subsection on banning retail sale of flavored products would be subject to a civil penalty up to $200 for the first offense and up to $500 for the subsequent offense. And as you see, and we talked about, I know yesterday, there's no separate penalty for the employee because in this case, it's really the burden is on the retailer to not have those items in their store for purchase. Action, again, brought in the same manner as a traffic violation and within 24 hours of the occurrence. 1014 is the ban on the sale of discounted tobacco products, tobacco substitutes, e-liquids, and tobacco paraphernalia. The term price reduction instrument gets used in here, so it is defined. It's a coupon, voucher, rebate, card, paper, note, form, sticker, statement, ticket, image, or other issue, whether in paper, digital, or any other form, used for commercial purposes to receive an article, product, service, or accommodation without charge or at a discounted price. And then the prohibition is on selling or offering for sale a tobacco product, tobacco substitute, e-liquid, or tobacco paraphernalia to a consumer at a price lower than the price that was in effect at the time the seller purchased the item from the wholesale dealer. So this says retailers cannot sell for a loss. They cannot sell or offer for sale a tobacco product, tobacco substitute, e-liquid, or tobacco paraphernalia through any multi-package discount, buy two, get one free, something like that, or honor or accept a price reduction instrument, that term is defined, in any transaction related to the sale of any of these items to a consumer. Penalty for violation, up to 200 for first offense, up to 500 for subsequent offense, again brought through Judicial Bureau. Section 3 amends the jurisdiction of the Judicial Bureau accordingly. First, just to update the description of and the reference to the section that is where the penalties are for selling to a minor, furnishing to a minor. Also adding 2 new provisions on sale of flavor products and sale of discounted products. Section 4 is same as in, I believe that's in the Senate version, updating the prohibition, updating the list of items that are regulated in 1005A. Section 5 we talked about yesterday, and this is the use of tobacco products, tobacco substitutes, and e-liquids prohibited on public school grounds. So the first piece here was adding e-liquids, which you had done in the Senate version as well, and then just clarifying that it's all of those terms that are being defined in 7 VSA 1001 on public school grounds or public school functions, and deleting that permissive language for school boards to adopt policies, including confiscation and appropriate referrals to law enforcement. They still can, but there may also be other appropriate referrals beyond law enforcement. Yes. Be upstairs in a minute.
Sorry.
No, that's okay. Go.
So this, when you strike out public school boards may adopt,
Yes.
remind me what that was about?
So there were two issues here. One of them was, I think some of the Human Services Committee thought it was confusing to tell public school boards that they may do something that they may do anyway. And so, they didn't need the explicit authority here to adopt policies. The other was concern about the specific reference to law enforcement and, whether that was sending a message that referral to law enforcement was more appropriate than cessation, or that might scare kids off from seeking assistance with, cessation activities.
Got it. Thank you.
Yes. Just checking to see if I'm getting something. Section 6 is the minor consent to treatment for nicotine and dependence on nicotine and tobacco products and tobacco substitutes. So you can see this is the existing statute that we had talked about, that has minor consent provisions in it, that is in the chapter on regulated drugs, which is what Vermont law calls controlled substances. So under existing law, if a minor 12 years old of age or older is suspected, and under existing law, it's to be dependent upon regulated drugs, to have venereal disease or to be an alcoholic. So this is why we are updating some of the language of the terminology we use. So this would update some of that language to say, if they're suspected to have a substance use disorder, including a dependence on regulated drugs, on alcohol rather than describing them as an alcoholic. And then the new provisions are on nicotine or on tobacco products or tobacco substitutes, as defined in Title VII, or to have, and then instead of venereal disease, a sexually transmitted infection. And the finding of such substance use disorder or infection is verified by a licensed healthcare professional. The minor may give, looking at the gendered language, consent to medical treatment. Sounds narrower than some of the wraparound services. So we changed it to healthcare services and hospitalization as under existing law. And in the case of changing a drug dependent or alcoholic person to an individual who has a substance use disorder. And these are just now updating languages: consent to non-medical inpatient or outpatient treatment. This is the existing law, that a program approved by the Agency of Human Services to provide treatment for, and changing to substance use disorder, if deemed necessary by the examining. And then we've changed from physician, which now it will be a defined term of healthcare professional. And we didn't include the or diagnosis or treatment of the dependency or disease or alcoholism, because that's what would be deemed necessary. Then there's the existing language: consent shall not be subject to disaffirmance due to the minority of the person consenting. Basically, we're allowing minors to consent so they can consent. And the consent of a parent or legal guardian of a minor consenting under the section is not necessary. This is again existing law. It also an existing law and not changed except for updating the terminology. The parents or guardian shall be notified. Oh, we didn't change position. If the condition of a minor child requires immediate hospitalization as the result of drug or alcohol use, or for the treatment of a sexually transmitted infection. And as used in this section, healthcare professional is a physician assistant, registered nurse, or advanced practice registered nurse. And the registered nurse piece in there was intentional because school nurses are typically registered nurses, not advanced practice registered nurses, but everyone as always would have to work within their scope of practice. So this doesn't we don't believe this opens the door to registered nurses doing more than they are legally allowed to do. Section 7 creates it is just some conforming language on the term e-liquids. It's also in yours. Some conforming changes in the definition of other tobacco products in the tobacco products chapter. Using the e-liquids language. Section 9 is an existing statute talking about the tobacco prevention and treatment program administered by the Department of Health. And the change here is that an existing law, the services provided by a quit line approved by the Department of Health shall be offered and made available to any minor upon, and just changed his or her to the minor's consent, who is a smoker or user of tobacco products, and we've expanded to include tobacco substitutes or e-liquids.
It's a quit line.
Quit line is I think 1-800 Vermont or VT quits, whatever it is, to help somebody get off of tobacco products, and in this case, we would be adding the nicotine side of things to it. Conforming change in section 10 is, this is in the master settlement agreement statutes in our Medicaid chapter. The definition of tobacco currently says means all products listed in 7 VSA 1001-3, which was pointing to the tobacco products definition. So instead we say all of the products listed in the definition of tobacco products in 7 VSA 1001. Section 11 is the Health Equity Advisory Commission report, in its annual report due in January, asking the Health Equity Advisory Commission to recommend whether menthol products should be banned. Section 12,
What's the date on that?
that is
January.
January 2025, and it's and they have an annual report due then, so just that one. Section 12 is very similar to language from the Senate, directing the Office of the Attorney General by December of this year to report on whether and to what extent Vermont can legally restrict advertising and regulate content of labels for tobacco substitutes, including oral nicotine products and e-liquids in the state. Section 13, this was language added in the Senate Finance Committee when the bill was in the Senate, directing the Department of Health to report by March 1st of 2027 of the results of the 2025 Vermont Youth Risk Behavior Survey relating to youth use of all of these products, along with comparison of the rates from former surveys. And in the House, they added that the department, which the Department of Health said it could do, would also provide data on retail sales of these products during calendar years 24, 25, 26. Section 14 directs the health department to collaborate with relevant school and community partners to survey and report on the use of tobacco products, tobacco substitutes, and e-liquids, as well as on nicotine and tobacco cessation efforts in Vermont schools. Also has the department in consultation with the Department Division of Liquor Control and the Court Diversion Program to develop options for diversion to tobacco cessation as an alternative to those existing penalties we looked at for a person under 21 years of age who possesses, purchases, or uses false ID to purchase those products. And with the report due January of 2026, findings and recommendations regarding the use in schools, cessation efforts in schools, and options for diversion programs. Section 14A is the investigator position being created in the Department of Liquor and Lottery to enforce and investigate potential violations of Vermont laws relating to direct-to-consumer sales and delivery of alcohol and tobacco products, including the first 3 sections are in the alcoholic beverages statutes, and 1010 is the one we saw that's internet sales of tobacco and tobacco-related products. Funding is appropriated in FY25 from the Tobacco Litigation and Settlement Fund. It expresses legislative intent to fund from that, or to support the position from that fund for fiscal years 25 and 26, and that beginning in 27, The funding will be built into the base funding for liquor and lotteries budget, with the amount of the salary and benefits for the investigator position offset by an equivalent amount of the revenue generated to the department or the office of the attorney general, or both, by the investigator's activities in enforcing and investigating violations of the law, with the remainder going into the general fund. And if at some point the revenue is insufficient to cover the cost of the position, then it directs liquor and lottery to propose eliminating the position as part of its next budget or budget adjustment presentation to the General Assembly. Requires liquor and lottery to provide an update by March of next year to various committees, including this committee, on the status of its implementation of the new investigator position, and also to report annually to the same committees by December 15th on the impact of the investigators' activities on compliance with Vermont's laws on direct consumer sales and delivery of alcohol and tobacco products. Finally, effective dates. All of the pieces relating to changing the tobacco statutes, adding e-liquids, banning flavors, banning discounts, etc. Take effect on January 1st, 2026. The findings, the two provisions on involving minor consent to treatment and all of the reports take effect on passage, and the investigator position takes effect on July 1st, 2024, with the first report under subdivision D2, the December report due in 2025.
Okay,
All right.
I think we're getting back to what was in the bill and what's here. So I think we're gonna come back to this later after 11, and I think what we should do is hear from Ted, because I'm sure your time is compressed. And just look at the fiscal note for the bill as it came over from the House.
Yes, I'm trying to find out if it all goes in the budget.
And then, because we have, you'll see at 10:45, we're scheduled for two experts. This on H72, and we don't wanna, and we also have H847 to get started with, but so we'll do this first. Thank you for being here.
Of
You
course,
haven't met everyone, have you?
I've never been on this committee.
Well,
so-
it's time. So you and I have met Senator Jenny Lyons and from Chittenden Southeast and Senator Ray.
You know me. Senator.
Okay,
Senator Terry Williams representing Rutland County. Dave Weeds from Proctor representing Rutland County.
Martine LaRoque Lewis from Burlington, representing Chittenden Central.
Great, and I am Ted Barnett, Joint Fiscal Office. It's a pleasure to meet you all. I also used to work in Rutland County. So I am going to try and hop into the Zoom link here for a second and share my fiscal note. Broadly speaking, the fiscal note is different than the fiscal note that was presented for the version as passed by the Senate last session. And we spent some time over the summer really digging into the data and also understanding. We have examples from Massachusetts and now California, which have implemented a similar type of ban as proposed. So I'm going to talk about how those all influence the fiscal note.
Representative Rebecca, we're going to be about 10 more minutes. And then we'll have you. Yeah, so. You can sit right there, or give permission.
And yes, I just shared the fiscal note, and so it should be posted to the date, but pretty recently. Broadly speaking, the bill is expected to result in the version passed by the House in a revenue loss of between 3 and 5.4 million in fiscal year 26. This is because of the implementation date in January, which results in a half a year lost revenue in fiscal year 26. That revenue loss increases to between 7.1 and 14.2 million in fiscal year 2027 with a full year of implementation of the ban. These revenue losses are split between general fund revenues, which are associated with cigarette taxes, the vape tax, other tobacco taxes, those rates are all different depending on the product. There's also a revenue loss for the education fund because of lost sales tax revenue on these products. Those are split on the table that is shared behind me. Where the range is so wide simply because it's really hard to understand how folks are going to respond to the thing. And broadly speaking, right, there are a couple of different responses that have different revenue impacts. There are folks who, if they no longer have access to flavored products, will switch to unflavored products, in which case we wouldn't see much of a revenue loss because folks are still buying tobacco products. There are some folks who would decide to quit altogether the flavor ban, but flavors are really popular, they're really motivated why they're using certain products. They decide this is a great reason to quit. If they quit, we're no longer seeing tobacco sales, and that's a loss of revenue. There's also a chance of cross-border sales that folks may decide to drive to New Hampshire and buy the flavored products there. So those are kind of the three different pieces. And we looked at each of them depending on the model. And that shows the wide range of potential losses here. Massachusetts is, they did see a pretty large revenue loss as a result of their ban. And so the upper end of these ranges reflect Massachusetts ban scaled to Vermont's kind of consumption patterns and just the scale inside the population in Vermont. I think it's unlikely that we would see revenue losses in the magnitude of Massachusetts, simply because their ban was implemented right in the middle of the pandemic. The JFO, generally any data that's coming out of the pandemic, we really look at 2, 3, 4, 5 times to really understand if that reflects what we can expect to happen in a time now, which is kind of beyond the pandemic. Also, the population distribution in Vermont is different than in Massachusetts. Massachusetts has really large population centers that are quite close to New Hampshire. And so you have a lot of folks who can more easily access flavored products, comparing it to where a lot of population is in Burlington. You would have to drive quite a long way in order to get to New Hampshire. And so I think Massachusetts, while it is helpful for understanding the potential range, I do think it potentially overstates the impact here. California, which has a different structure, right? You have to drive for quite a long way to get to neighboring states to access products. They saw a slightly smaller revenue loss when scaled to Vermont. It kind of falls within the middle part of this range, and could be a more helpful analog when looking at these data and trying to assess the tax revenue loss. And then kind of the lower end of our range was based more on the model we were using for the fiscal note that we presented last session. And that really digs into the behavioral response and what proportion of folks would quit versus switching to unflavored products. And so that's the lower end of the range there. I can go into more. Oh, and then scrolling to the one thing I would additionally mention for Massachusetts is at the same time they implemented the ban, they also implemented a 75% tax on ENDS products, which is electronic nicotine delivery services. And so at the same time they're implementing a ban, they were implementing a new tax. And so that's also part of the reason why there was a large loss in there was a large behavioral response to that.
Two things. This says as passed, as recommended by House Ways and Means. Were there changes on the floor that would, there's a new position
Yes,
from the floor, that's not in here.
that's not in here. I simply haven't had time to update
Yeah,
it from
that's
the
okay, I
floor.
just wanted to make sure that, and was there other changes on the floor that would have impacted this?
Not
That, okay.
fiscally, as far as I'm aware. Yeah, so the investigator position, $160,000 out of the tobacco settlement fund in fiscal years 25 and 26.
Okay.
Yes, and that's it, yes.
And then the other thing is, I'm assuming you've seen the testimony from Commissioner Levine about the healthcare savings. And I know that JFO is always cautious about including those kinds of things in their fiscal notes, but it seems that a mention at least is warranted, and I'm wondering if you guys have discussed that as an option.
Caveat.
Yes, we do, in the fiscal note, there is a paragraph that does note, that the long-term public health benefits of reducing tobacco use are undeniable. JFO certainly doesn't, it's just for, our office, we really focus on near-term kind of direct tax direct near-term tax revenue implications. And it is very difficult to estimate things that may happen both in the near term and decades in the future. So we didn't come down on whether the health savings would, or the healthcare costs and savings would outweigh the tax revenue losses. But I do understand that testimony to do that analysis.
Yeah, I mean, I think it's worth, a paragraph in your final fiscal note to say that there are likely to be significant long-term health
Based on,
cost savings, with it. I know that I'm just
we
putting
don't
that on the
want,
record.
we don't
but-
want you to violate your policies, however,
Yeah.
so I think there's that, just, if you can update this at some point for us, I don't know, see how it goes, but we heard the comments about floor changes, so that's all, Senator Wood.
We just mentioned that it might take decades to bear the fruit of a ban in terms of health outcomes. Is it really decades? Did Dr. Levine posit how long
I think it may be in his data, I think there might be more instant returns,
Okay.
slower trajectory. Yeah. So that's not Ted's job.
I know.
Go ahead.
I was curious from the fiscal note, you've got estimated revenue impacts for this 18. These are losses of tax revenue, correct? Not business revenue. So is that correct?
Right, we do not forecast business revenue losses. So these are focused on general fund, cigarette, vape, other tobacco products taxes, and then sales taxes on those products.
Okay.
Okay. Thank you for being available this morning. Greatly appreciated. And I know you've got other things on your mind beside updating the fiscal note. So we do understand that. So we appreciate it.
I'm hoping I have a little time this afternoon, so
Okay.
I will share it with the committee if I'm able to.
Sure. And just send it to Kiki and she'll give us a heads up and get it to us. That's great. Great. Thank you.
Of course, I can.
Good to have you in here. All right, so we are going to, we're gonna keep moving. I was hoping to get a break in here somewhere. We'll try that, but Representative Rebecca was here on H 847. I thought we'll listen to Representative Rebecca briefly, and then if we have time with Katie, go through a little bit, but we can always come back to this one. This is just the beginning for us on the bill. Thank you for being here.
Morning.
Good morning.
So Representative Rebecca, from the Healthcare Committee for having me today. Do you all want paper copies or do you do digital?
We have.
You got paper?
I do.
Thank you.
Sorry.
Somebody
Somebody,
or?
I do.
Yeah, no, I think everybody would like that. That'd be good.
What?
This is your.
Okay, so many of you know that Vermont's been working for years to formalize our existing peer workforce. And you may know that we are second to the last in the nation to formalize an existing peer workforce and to have a formalized certification process and standardized training for that workforce. And just to kind of refresh you, peers are people that have lived experience of a mental health or substance use challenge. And peer support workers are people who are employed like at designated agencies to assist individuals who are experiencing a mental health or substance use challenge in their navigating treatment or recovery supports. The peer support workers empower people through those difficult transitions, and there's a lot of research and evidence that shows that that job improves engagement in self-care and wellness. It increases people's sense of hope and inspiration, their social functioning, and really importantly, it reduces hospital admission rates and it decreases substance use and depression. So there's a lot of evidence to show that this is best practice across the nation. It is overdue for Vermont to formalize this work that's already happening in the state. And it's already a critical part of our delivering quality care that's appropriate and it's effective. So what this bill does, H.A. 47, would enable the process to formalize the already existing workforce in Vermont, qualified mental health support specialists and recovery coaches, with the support of a certifying entity, the Department of Mental Health and OPR. And then those professionals can standardize training and be certified in a manner that allows the state to be reimbursed by the federal government, CMS, for Medicaid for those services. And all of those would be determined during the rulemaking process, which is really what the bill facilitates. So again, I just really want to emphasize that in the other 48 states that are doing this, we have a lot of evidence that, you know, implementing the peer certification work and having a standardized curriculum and training process really has given incredible outcomes on, you know, advancing health equity and reducing healthcare costs. So it does go both ways too. 60% of respondents in one study reported that transitioning off or reducing public assistance while working as a certified peer worker. So it also, you know, employs a really important part of folks with lived experience to inform not only, you know, improving our practices from a point that is, you know, culturally informed on folks with lived experience that can directly teach other folks in the designated agencies on being a little more informed and person-centered. So this is something we need to lift up, improve our quality, as well as our cost of care in Vermont. Just to close, I want to really emphasize that the bill is intending to empower OPR to begin the process of certification of peer support providers and recovery support specialists so that they can be formally recognized for their work and that the state can be reimbursed by Medicaid for those services. And that we can align ethical standards of that work to support Vermonters' mental well-being and folks on their paths to recovery. A lot of the details, when you get the walkthrough of the bill, you'll have questions about all of the details, so I just want to remind you that this is really to help OPR stand up that process, and much of the details are going to be sussed out through the rulemaking process, which you know is, you know, heavily rooted in stakeholder engagement, will come to us again through LCAR, and so Jen or Pete will hopefully clarify that process for you if you have questions about the details of recovery coaches and those roles and where stakeholder engagement will help to inform that.
Thank you. This is exactly what we want, the testimony we want to hear. We've just finished a bill that's coming over you on recovery residents. And so this fits nicely with the development of those residences and having peer support folks available. Great. Thank you.
Thank you.
And we may reach out again, you know, you're important, you're report on the floor is helpful to us. Thank you.
Thank you. Thank you for your work.
So Katie, let's, why don't we do like a 10,000 foot?
Sure.
And what I'm gonna suggest is if we can do that, how long do you think that might take?
Whatever time you have.
I think we're supposed to finish a little before 10:45.
Okay.
We've got the experts from Research Triangle and Brown on Zoom with us, so good.
Understood, okay. Good morning, Katie McLean, Office of Legislative Counsel. We're looking at H47, and this is looking at the certification of two new professions, peer support providers and recovery support specialists. I'll try to give you a high level here. So the first section of the bill is amending language that governs which professions OPR regulates, and you'll see that peer support providers and recovery support specialists are added to the list. Section 2 is amending a section that gives OPR authority to do criminal background checks of individuals in certain professions. It's a long list, and you'll see that peer support providers and recovery support specialists are being added to that list. Section 3 and 3A have to do with the fees structure, both for the initial licensure and for the biennial renewal. It's covered in two sections under our tiered effective dates, which you're used to seeing when we amend the same section twice. So first you have an initial application fee of $50. The biennial fee is $50. But then 3A takes effect on July 1 of 27, and you'll see that it amends the initial application fee for certification from $50 to $75. So that's why we're amending the same section twice. And then at the top of page 4, there's the creation of a whole new chapter within Title 26, which is our title on professional regulation. And this is adding regulation of peer support providers and recovery support specialists. There are a number of definitions. I do sort of want to pause and talk about what is meant by peer support and what is meant by a recovery support specialist. The definitions are long, so I think it's worth just flagging for you. So peer support means the provision of those services that address mutually agreeable issues or areas of life consistent with the code of ethics for peer support providers. Code of ethics is defined up above. And code of ethics is a code that's approved and adopted by the Department of Health. So that's sort of the governing document here. So it's consistent with the code of ethics that are reasonably related to increasing an individual's capacity to live a self-determined life on their own choosing, and that are provided in a mutual relationship between individuals with a lived experience of trauma, mental health, or substance use challenges. Peer support emphasizes a non-judgmental, values-driven approach that promotes multiple perspectives, advocates for human rights and dignity, and focuses on genuine mutual relationships that enrich the lives of those involved. Peer support includes providing health and wellness supports, supporting individuals in accessing community-based resources and navigating state and local systems, providing employment supports, including transitioning into and staying in the workforce, and promoting empowerment and a sense of hope through self-advocacy. Does not include the provision of psychotherapy. And then I'll skip ahead to recovery support services. So you are aware of what the definition is there. Means a set of culturally competent clinical evidence-based activities coordinated through a written individualized recovery plan of care that documents a substance use disorder and reflects the need and preference of the individual in achieving the specific individualized measurable goals specified in the plan. Recovery support services include a range of social and other services that facilitate recovery from substance use disorder, support health and wellness, and link individuals with service providers and other supports shown to improve quality of life for persons and their families and seeking recovery from substance use disorder. And again, does not include psychotherapy. Credentialing body for recovery support specialists means an entity authorized by the Department of Health. to, in addition to other duties, issue credentials and approve acceptable continuing education courses. So you can already see that peer support is very much I don't want to say governed, but is very much influenced by Department of Mental Health, whereas recovery support specialists are working with the Department of Health to create their structure and their policies. Prohibition and penalties. Basically, this section says that you can be a peer support provider or recovery support specialist even without a certification. Getting the certification is voluntary. But if you're going to call yourself a certified peer support specialist, peer support provider or recovery support specialist, you have to have the certification. And then we have the directors of the duties of the director.
We're all
meaning
in
the
the same, we're all in the same.
I apologize. Meaning the director of OPR, Office of Professional Regulation. So, the director is responsible for providing general information to applicants for certification. As either a certified peer support.
You can stay up.
Okay,
Yeah.
sorry, so
No, that's okay. I know it's hard.
I'll move faster. Duties of the director. I'll fly through that.
And we'll have OPR and to
Sure.
sort through.
The next section, 3194, is on advisor appointees. This allows the Secretary of State to appoint advisors in consultation with mental health and health department. These are persons working in the field who can help provide advice about the regulation of these professions to OPR. And talks about how these people are selected, what their qualifications would be to be selected. Section 3195 is eligibility, so what are the requirements to become a certified peer support provider or recovery support specialist? It's covered in that section. Section 3196, certificate renewal. This governs the process that every 2 years, a person who wants to be certified in one of these fields, the process for retaining that certification, language about how the requirements will be determined in rule, biennial fee, language about unprofessional conduct. So unprofessional conduct, as we already said, is misusing that professional term, but there's also other conduct that's listed and applicable to other professions. It's listed in 3 VSA 129A. And then, let's see, skip ahead to section 5, which is rulemaking. So by September 1st of this year, the Director of Professional Regulation would be required to submit an initial proposed rule to start the rulemaking process. As we've talked about before, that's sort of step 1 in the rulemaking process. That's having the rules written, filed, but this is before ICAR or LCAR would be looking at the rules. And then our effective dates, which I've already sort of talked you through in part, that one, tiered one. So this takes effect on July 1, 2025, except that this section, meaning the effective date section and the rulemaking section, take effect on passage. And then, that one sort of caveat with the fees, that the initial fee takes effect on July 1, 2025 and then is updated July 1, 2027. So that is the very high level version of this bill.
You know, there's a lot in here. Thank you for that.
You're welcome.
You may not know the answer to this, but you were listening to the conversation in the House and maybe you can offer some insight. So here we have a cadre of folks dealing with some of the probably most intense life challenges. I'm wondering why the certification was considered to be a voluntary versus mandatory. Just wonder if there's any background you can share that you might have gained. If you don't, I'll ask the next.
I mean, this question came up several times, and I think different persons in the field had different perspectives. One of the big draws of having it is to be able to pull down Medicaid funding, but there are some people who are doing this now, and
potentially their work wouldn't require them to have a certification. They don't feel the need to pay the fee and receive the certification and can choose not to. Other persons who testified indicated it's sort of a professionalizing of the field. It gives the client that you might be working with some reassurances as to what your training and qualifications might be if you have the certification. But I think that is a question that there are probably many witnesses would like to
Okay,
weigh in
very
on
good.
that particular question.
And, yeah, it's a good question. In some ways, it relates very much to the reason that we asked OPR and others to work on the certification process. So, and so we'll take tests. Let's take a very, very short break. We have experts waiting online and we'll go offline for 5 minutes.